guys, Dr. Anderson here. I'm here with Alan and Dimple. They're way up in Canada and they came down here to Colorado. It was in June of this year of 2024, and they've got a really interesting story. We're seeing more of this. We don't see a lot of it, but we are seeing people that have this story of what we think is COVID vaccine injury, nerve injury. And some of our videos that are pretty popular on YouTube are actually people that have shared their experience coming to us. It's just a handful, not a lot, but people that have found that we are able to help them with what we call nerve decompression surgery. So, but I just want to start with the story of this because her symptoms were those of restless legs, neuropathy, and Alan's going to talk to, but Alan, the husband, has been very articulate about this, and Dimple needs to talk too about her symptoms. but I would like you. I mean, just start out. I'll let you just talk about what the history of this, because I think people need to hear and understand what happened. You had a vaccine. Just go through the story. You've told it many times, and for
So at
people that are listening.
COVID, right, we got the second vaccine. And after the second vaccine, we noticed that there was a problem with her ability to walk. She was, having symptoms, which we didn't know the technical term, but now we know it is restless leg syndrome. And she had a lot of neuropathic pain. Before that, none of these symptoms were visible. And, we did a lot of research on, YouTube. We met three top neurologists in Toronto, very intelligent doctors, but no one was able to really diagnose what the actual issue or problem was. And then after 4 years of suffering, unfortunately, being in bed, I would say, right, Dimple, um, you know, 18 hours a day and a lot of pain and not being mobile, I happened to run across Dr. Anderson's videos, and that's when we reached out and decided that we would take a leap of faith and visit him.
Right. And so that's a long time, 4 years. You're reminding me now. And I remember because we do Zoom meetings.
Yeah.
Uh, it really impacted me when I did my Zoom meeting with y'all because I remember you were up close to the screen and she was in the background, and I was like, my gosh, she's suffering. I mean, she was moving, and it's hard for you to sit still in the background. And Alan did most of the speaking for you.
Yeah.
But it's like, I hope to God I can help this lady, you know. So, because you were really having a hard time of it, and so you came down. We did these procedures in June, and maybe this because there's things about your situation now that are better, but there are other things that are maybe not as much better as you'd like. And I want to just be very transparent about that. Don't hold anything back, okay? But I want you to just tell everybody what's really going on with you, because it sounds like I'm kind of leading you into this. Sounds like restless legs are significantly better. You were maybe 90% or more, but now
Yeah.
it's maybe backslid a little bit to 70, and that's not uncommon. I've seen that. So hopefully that will just stay stable. You're out 4 months, so that's pretty good that you're there. Uh, but what I mean, and I know there's some pain. Let me I want to let you guys talk. Just explain what's been the most awesome part and what is the area that you still hope gets a little bit better. Because you're just providing hope. Just the fact that you're not in a wheelchair and you're walking, you don't need a walker now, right?
Yeah, I would think that if you
That's
agree,
incredible, huh?
yeah,
That's a
yeah,
huge
that's what you're saying.
change.
Yeah. The
Right.
mobility, the main thing. I mean, I think, would you agree? You would feel helpless because if you can't really get out of bed and walk independently,
You're
it,
dependent on somebody, and that's, a little frustrating.
yeah.
Um,
Right.
but like you said, we went on a vacation. Me not using a walker or
Right.
we was a huge difference.
I didn't like that because if we had the wheelchair, we get
Mhm.
priority access. So,
Okay.
but other than that, she was independent for the most part. And I was quite shocked because I was scared about her not using a wheelchair or walker, but she did it.
Right.
Setbacks. We've had a couple of falls, but she's still strengthening her muscles because I think what is the term? Muscle atrophy. She had
Right.
quite. The only one thing, and just in full transparency, is that the pain is less, but it's not gone.
Right.
And we're kind of perplexed, and we don't know if it's because of the nerve damage, because of the vaccine, or what exactly. We do know the nerves are damaged. We just don't
Right.
know how to deal with the pain and
So
get
the
that.
thing that's lagging behind is the pain. And you said it's not as frequent. It used to come about, what do
Couple
you
of,
say, every 2 hours? Now it's maybe every 4 to 6 or something.
4 hours now. But I
Yeah.
remember when I came to see you, I remember you were saying that you were gonna get better 85% or 75%,
Right.
but not promise the pain. I remember you were saying that too.
Right. Right.
After the surgery, the pain is a lot less what it used to be.
Right.
Be taking a lot more painkillers before compared to now.
Okay.
yeah,
Compared to now. And so, but you're sleeping better, true? The
Much better,
restless legs?
right?
So you're
yeah.
not jerking and you're having to not twitch around as much.
Not as much at all.
Jerking is way better.
Yeah.
Do you have to get up at night because of that as much? No.
Using your legs to get up at night.
No,
He's asking.
no, no,
Okay.
So
no.
you're definitely sleeping more
Yeah,
sound.
yeah.
Awesome. Awesome. Uh, boy, that's incredible. So, I mean, and this is a novel idea. I mean, and I'm just going to share with people that are listening, and this is just hypothetical. It's theory. Don't, you know, whatever. It's just theory that when we see this with people that have chemotherapy-induced neuropathy sometimes, and it could be a little bit with restless legs, but I think there may be evidence that the vaccine could be toxic to nerve tissue. That being said, if you've had a vaccine and you had pre-existing nerve tunnels in your body that were already a little bit tight, once the nerve is not as healthy because of the toxicity, it's going to make that nerve tissue more sensitive to the compression that may already been in existence. Okay, so then it just triggers this whole thing, and it's so amazing because you're just, I'm very excited for people listening, because if people are out there listening and maybe they have restless legs, I have another patient or two that have had significant improvement. I think they're on YouTube for their neuropathy, but this is more restless legs. You had a bit of both, but it's indications that, and it's helping to prove to people too that both restless legs and neuropathy are oftentimes due to compression of tight nerve tunnels. So it sounds like sleeping better,
Yeah.
restless legs much better. Balance is, you still might fall a little bit, but at least you don't need a walker most of the time, right?
Yeah. Difference.
What's that?
Surgery, a huge
Yeah,
difference
for
after
sure.
the surgery.
Right. And because Dimple had a drop foot, for those of you listening,
Yeah.
where she couldn't pull her foot up into the side, and that is quite considerably better, would you say?
Oh yeah,
Yeah, the drop
Okay.
of the,
that's gone.
yeah, she can lift her foot on her toes.
Yeah.
And with the
Awesome.
physiotherapist, we were practicing exercises on that. So
Okay.
she's not walking like a duck, quote unquote, anymore. She's able to
Okay, good.
Mhm.
Okay. All
yeah.
right. Anything else you guys want to say? This has been awesome. I really appreciate
Uh,
you having the faith to come down. You're better, and hopefully you're going to get better still. We'll be following up with you, of course. What's that, Alan?
take a leap of faith. Dr. Anderson is who he says he is. Don't be skeptical. It worked for us. It'll work for you.
Right. Really appreciate that, because a lot of people don't know about this. And I know there's lots of people out there well, we see them on our YouTube channel, because they make comments, and they've just had problems with it. And
Yeah. There's no reason to suffer. I mean, if you can get help.
exactly. Okay. Anyway, God bless you guys. Appreciate you volunteering. Dimple, you did awesome.
Thank you.
And Alan, as always, you're very articulate and good.
Maybe
Can explain things. What's that?
May or June, you think we can touch base again? Just a quick follow up, maybe April or May.
Yeah, we'll do that. Well, we're going to be following up probably in a month or two. We'll be doing that. Okay.
All right.
All right.
We'll schedule that. And you guys, thanks again. And if you're new to this, guys, and you're listening for the first time, understand I've done research on restless legs. We have one written paper, one documented research paper. Hopefully another one's going to be published soon. We also have a book called A Perfect Night's Sleep for those of you suffering with restless legs that you can get on Amazon. It's called A Perfect Night's Sleep. But thank you for watching, and also consider subscribing to our YouTube channel. And thank you for your time tonight. Appreciate it.
Bye.
Bye-bye.
Bye.
Bye-bye.
Bye.
Take care.
Take
Take
care.
care.